Now we are going to discuss the ethmoid air sinuses. But before doing the ethmoid air sinuses, we should know something about the anatomy and the different parts of the ethmoid bone itself. Now I will show you the different parts where the ethmoid bone is visible on the skull. This is the cranial cavity and you are looking at the anterior cranial fossa. This structure here is the crista galli, and on both sides of the crista galli is the cribriform plate. All these structures are part of the ethmoid bone. Then this crista galli, it extends down into the nasal cavity as the perpendicular plate of the ethmoid bone. Now this is the nasal cavity, and this bone inside, which you can see, is the perpendicular plate of ethmoid bone, which forms the part of nasal septum. Then comes the labyrinth of the ethmoid bone. Labyrinth of the ethmoid bone forms the boundary between the orbit and the nasal cavity. And if you see from the inside of the orbit, you can see this bone here, in which you can see different air cells. This is the labyrinth of the ethmoid bone, which forms the lateral medial wall of the orbit and the lateral wall of the nasal cavity. Now I will show you a diagram so you can understand the different parts of ethmoid bone more easily. Now here is a diagram showing the different parts of the ethmoid bone. This bone with the darker color is the ethmoid bone. This structure over here is the crista galli, and on both sides of the crista galli is the cribriform plate, and then comes the orbital plate of frontal bone. If you see it on the actual skull, here is the crista galli, on both sides is the cribriform plate, and then comes the orbital plate of frontal bone. And obviously beneath this orbital plate will be the orbits. So beneath the orbital plate of frontal bone are the orbits. Then comes the perpendicular plate of ethmoid bone, which forms the nasal septum. And here in the actual skull, this is the perpendicular plate of ethmoid bone, which you can see inside the nasal cavity. Now this structure and this structure, which forms the boundary between the orbit and the nasal cavity, this area is called the labyrinth of ethmoid bone. And from the labyrinth you can see two projections, the superior and the middle concha of the nasal cavity. Now this is a sagittal section of the skull, which is showing you the lateral wall of the nasal cavity. So this is the structure, the superior and the middle concha, which are parts of the ethmoid bone, and they are seen in the lateral wall of the nose. So inside the labyrinth of the ethmoid bone there are cavities, small bone air-filled cavities, which are called the ethmoid air sinuses. Now there are three types of ethmoid air sinuses: the anterior, middle, and the posterior ethmoid air sinuses. There is no clear boundary between all the three parts, the anterior, middle, and posterior ethmoid air sinuses, but they are named according to their openings inside the nasal cavity, as they are the three parts open by three different openings into the nasal cavity. So they are called the anterior, middle, and posterior ethmoid air sinuses. This middle ethmoid air sinus, that forms a large swelling inside the nasal cavity, just deep to the middle concha, and this is called the ethmoidal bulla. In this diagram you are again looking at the lateral wall of the nasal cavity, in which this purple bone is the ethmoid bone, this is the superior concha, and this is the middle concha. Now in the next diagram, this middle concha will be removed to show you the ethmoidal bulla. In this diagram, the middle concha has been removed, and you can see this elevation, the ethmoidal bulla, which is formed by the middle ethmoidal air sinus. If you can again see in this diagram, this is the ethmoidal bulla, which is lying deep to the middle concha of the nose. Now in the next diagram I will show you a picture in which both these concha and part of this bone has been removed, so you will be able to see all the air cells of the ethmoid bone. Now in this diagram you can again see the lateral wall of the nasal cavity, in which both the superior and the middle concha have been removed, and you can clearly see the ethmoidal air cells. Now this is another diagram showing you the transverse section of the skull, in which the head has been removed, the hair and the scalp has been removed. This is the nose, these are the orbits, this is the part of the brain, this is the optic nerve, and you can see the optic chiasma. This inside the nose is the nasal septum, and on both sides of the nasal septum you can see this cavity, which is the part of the nasal cavity, and on the lateral side of the nasal cavities you can see the ethmoid air cells. So you can again see it forms a boundary between the nasal cavity and the orbits. So these are the ethmoid air cells, and you can again see there is no clear demarcation between the anterior, middle and posterior ethmoidal air cells. And right behind the ethmoid air cells you can see the sphenoid air sinuses. Now let's try to find the openings of the ethmoid air sinuses into the nasal cavity. So ideally we should see three openings, one for the anterior ethmoidal air cells, the other for the middle ethmoidal air sinuses, and the third for the posterior ethmoidal air sinuses. Again we are looking at the diagram of the lateral wall of the nose, in which the middle concha has been removed and you can see the ethmoidal bulla deep to it. And just below the ethmoidal bulla you can see this groove which is called the hiatus semilunaris, which leads into the infundibulum, into which the frontonasal canal of the frontal sinus opens. So this arrow shows the opening of the frontal air sinus, this here, into the infundibulum of the hiatus semilunaris. Just behind the opening of the frontal air sinus you can see the opening of the anterior ethmoidal air cells. So it is also found in the infundibulum of the hiatus semilunaris. Then over the ethmoidal bulla you can see the opening of the middle ethmoidal air sinus, and the point to remember here is that the middle ethmoidal air sinus itself is formed by the underlying middle ethmoidal air cells. So the opening of the middle ethmoidal air cells will be on the ethmoidal bulla. Then comes the opening of the posterior ethmoidal air cells, and it is seen here in the superior meatus of the nose. So if you remove the superior concha, then you will be able to see the opening of the posterior ethmoidal air sinuses into the superior meatus of the nose. So these were the openings of the ethmoidal air cells. Again I will repeat, the anterior ethmoidal air cells open into the infundibulum of the hiatus semilunaris, the middle ethmoidal air cells open directly onto the ethmoidal bulla, and the posterior ethmoidal air cells open into the superior meatus of the nose. Now I will show you a diagram which is similar to this diagram, in which the arteries have been shown, and you will be able to see the blood supply of the ethmoidal air sinuses. So this is the orbital cavity in which the roof has been removed. This is the nasal cavity, and these are the ethmoidal air cells. This is the optic nerve, this is the optic chiasma. So I will show you these structures in this next diagram. Here you can see this is the eyeball, and this is the orbital cavity in which the roof of the orbit has been removed. These are the ethmoid air sinuses. This is the optic nerve, and this is the optic chiasma. This artery here is the internal carotid artery. The internal carotid artery gives rise to a branch which is called the ophthalmic artery. The ophthalmic artery inside the orbit, as it runs on the medial wall, it gives two branches. One is the posterior ethmoidal artery, and the other is the anterior ethmoidal artery. There are two foramina on the medial aspect of the medial wall of the orbit, which are the anterior and posterior ethmoidal foramina. Both of these arteries will leave through the respective foramina and enter into the ethmoidal air sinuses. So the anterior and posterior ethmoidal arteries will supply the ethmoidal air sinuses, and the anterior ethmoidal will also supply the frontal air sinus, as the frontal air sinus lies just in front of the anterior ethmoidal air sinuses. Now coming towards the nerve supply of the ethmoidal air sinuses. This is a diagram showing the orbital cavity again without its roof, and this portion is the ethmoidal air cells portion. This is the optic chiasma, the optic nerve, This is the trigeminal ganglion from which the three branches of the trigeminal nerve are arising: the ophthalmic, the maxillary, and the mandibular. The ophthalmic nerve then divides into its further into its branches: the lacrimal, the frontal, and the nasociliary nerves. Now, the nasociliary nerve gives off two branches. One is the posterior ethmoidal nerve, which enters through the posterior ethmoidal foramen in the medial wall of the orbit into the ethmoidal air cells. And the nasociliary nerve itself continues upwards, and the termination of the nasociliary nerve passes through the anterior ethmoidal foramen, and it is now called the anterior ethmoidal nerve. So the posterior ethmoidal nerve is a branch of the nasociliary nerve, and the anterior ethmoidal nerve is the continuation of the nasociliary nerve that passes through the anterior ethmoidal foramen. Both these nerves will go and supply the ethmoidal air cells. The third nerve supply for the ethmoidal air cells come from the pterygopalatine ganglion. So the branches of the pterygopalatine ganglion which enters the orbit, that are the orbital branches of pterygopalatine ganglion, they also supply the ethmoidal air cells. Now again, looking at this diagram to see the lymphatic drainage of the ethmoidal air cells, as the ethmoidal air cells are lying somewhere over here. So this area is the distribution of the submandibular lymph nodes. So the anterior and middle group of the ethmoidal air sinuses are drained into the submandibular group of uh, lymph nodes, but the posterior group, as it lies close to the sphenoid sinus, so both the sphenoid sinus and the posterior group of ethmoidal air sinuses, they drain into the retropharyngeal group of lymph nodes.